It's a challenging time to treat patients with any chronic illness, especially those with pain. And Lyme's disease is no exception. It's a very challenging disorder. By the time they make it to a pain specialist, it's become a chronic disease. And they're not just affected by the symptom of pain, they have other neurological symptoms. A lot of times the patients will say, I have this weird tingling, or this weakness, or this fog. One thing about Lyme's disease, in the early stages you can have focal pain, arthritic-like pain, but in the later stages it really becomes a neurological condition. So it's very challenging to treat these patients, and like most conditions we use a multimodal approach. Of course we try to avoid controlled substances when we can, but I've been faced with patients with tertiary Lyme's disease who just have such terrible diffuse pains that we have to rely on drugs like opioids. So most clinicians, when they talk about adverse effects of opioids, focus on what they hear in the lay press: abuse, addiction, diversion, overdose deaths related to opioids. But those of us on the front lines, we see the more common side effects of opioids: constipation, sedation, nausea, sweating, itching. So although abuse and addiction is a problem out there in our society, what we're faced with most of the time are the bothersome side effects of opioids. 20 or 25 years ago in my training, I was taught to use over-the-counter stool softeners and laxatives. This week I prescribed opioids to patients. I used over-the-counter stool softeners and laxatives. And when you look at the studies about opioid-induced constipation, we know for many patients those drugs simply don't work. Stool softeners and over-the-counter laxatives are not enough for some of these patients. And you think, how could constipation be that bad? Well, let me tell you, constipation can be that bad. You talk to the emergency room physicians. People with refractory constipation come into the emergency room screaming in pain because they can't move their bowels. And when they do, it's a painful process. So it's been a welcome to us as clinicians to have new pharmaceutical agents that have been developed specifically for this problem that we call OIC, or opioid-induced constipation. And there are different classes of these medicines which we're using both independently or in combination, which have made a remarkable difference for those patients who didn't respond to the other agents.